Dean Delaney, graduates, family, friends, faculty, honored guests, I am thrilled to be with you here this afternoon. This is an absolutely fabulous day. I am honored to share it with you. Thank you for the invitation, and congratulations, graduates, on your achievement. There are simply not enough moments in our lives to pause and celebrate. So take it in. Take in all that you have achieved, all of the pride and pats on the back from family and friends, all of the congratulations from faculty, staff, and mentors who are excited about your futures. It is wonderful to look out on this group and see so many talented people who are partners in the work of protecting, maintaining, and improving health. I know you are here because of your drive to make a difference, to have a positive impact on the lives of others. And so today, as you get your diplomas, your credentials, your receipts, your bona fides, as they say, I want to say out loud what I hope most of us know and hold dear. Being a nurse is more than the coursework and the diploma. It's more than the paper. It means embodying what that paper represents. Yes, your diplomas and degrees represent a level of competency and clinical knowledge. For the PhD recipients, it represents skills and research methods. Both are needed for us to face today's health challenges, to improve chronic disease care, to make sure children get a healthy start, to make sure adolescents and older adults are socially connected and have the supports they need so that they can thrive, to eliminate health inequities and mitigate the health threats of climate change. Some of you, thankfully, have trained in informatics, so providers and administrators can make timely, data-driven decisions, make use of big data, and take full advantage of artificial intelligence, recognizing its risks and its benefits. Thank you for your commitment to continuous learning over the course of your career, because the healthcare landscape is ever-changing. You all know this, and I think you all also know change is needed. How many times in Minnesota do we say we have some of the best health care in the country and some of the worst health inequities? Something's wrong with that. How many times have we heard that in the United States we spend more money, both per person and as a share of GDP, on health care and have worse outcomes than other high-income countries? Something's wrong with that. When you compare the United States to other high-income countries, the U.S. has the lowest life expectancy at birth, the highest death rates for avoidable or treatable conditions, the highest maternal and infant mortality, the highest rate of people with multiple chronic conditions, and among the highest suicide rates when you compare us to other high-income countries. Which is why there's job stability in healthcare. But I'd prefer a world where we could make it with a little less healthcare, because we have created the conditions from cradle to grave for people to be well. Part of what public health and safety net hospitals and clinics like the one that I work at do is fill the gaps of a broken system. And we need you in all of these spaces because the needs are high. And we need you in public health, whether it's local public health, whether it's in mobile units or shelters or schools, whether it's in family home visiting or as collaborators in strategy to improve population health, as collaborators as we build public health informatics, And we need you in the public health space in the same way that you are needed in clinics and hospitals and in academia. We need you because of your knowledge and your skills and your ethos, because of your holistic orientation toward the whole person. We know that the nurse of the team often has the strongest relationship with the patient. You provide comfort and care during the most challenging of times, and you help to celebrate patient successes. I'm a primary care provider. Some of you all will be primary care providers. And as a primary care provider, I have always said the most important tool in my clinical toolbox is my relationship with my patient. Some of you will work in inpatient settings. In the hospital, nurses are at the bedside during some of the scariest and most vulnerable moments in people's lives. Nursing is a profession that offers not only a career, but a calling, a chance to serve others with compassion, empathy, and skill. Nurses advocate for their patients, ensuring that their voices are heard and their needs are met. Advocacy looks like making sure patients' concerns about their care are addressed. Advocacy means speaking up to avoid medical error, to stop the line when something doesn't seem right. Advocacy means speaking up so that our systems are safe, both for patients and for those who work in healthcare. Advocacy also means speaking up about our broken system. It means getting angry, but not just angry, also activated. Activated about healthcare and activated about poverty and about homelessness and about injustice. Because no one should have to choose between feeding their children and filling a prescription. No one should have to be discharged from the hospital unit to the street or to a shelter. No one should forego care because they are worried about costs or medical debt. Yet these things happen every day. And unfortunately, many times it passes right over us. Oh, another GoFundMe campaign to help a family pay for medical care. Imagine being in that circumstance. How scary, how stressful, and it's happening every day. And we can't ever expect everyone to achieve their optimal health outcomes in Minnesota if we continue to have the worst educational disparities in the country. 2018 data showed that only around 30% of Black, American, Indian, and Latinx fourth graders in Minnesota achieve proficiency in reading. Same for 8th grade math, and 4th grade reading and 8th grade math predict your educational trajectory. What? Come on now. How can we get to health equity when these are our educational outcomes? How can we produce a robust healthcare workforce if these are our educational outcomes? You know, I was at the state's Martin Luther King Day celebration in January at the Ordway Theater, and Carolyn Wenga, who is CEO of Essence, who moved to Minnesota from Kenya when she was a child and grew up here and has done big things. In the program, she mentioned that the Maasai in Kenya greet each other by asking, "How are the children?" Now think about that for a second. Not how are you, not how are your kids, but in how are the children, meaning all the children in the community. Wenga turned to the audience, your fellow Minnesotans, and she asked, "Are the children okay?" And you all know what they said. That's not a question, that's a statement, because you all know what they said. Are the children okay? And without skipping a beat, the audience said, no, the children are not okay. And the Minnesota Student Survey, which is data we collect at MDH, shows it with the highest rates of adolescents reporting struggling with a long-term mental health problem. So here's the rub, my friends. We have not put the talent in rooms like this together enough in a sustained way to focus on the root causes of disease, disability, and despair. Not nearly enough. And addressing those root causes, that's got to be healthcare's job too. So as Commissioner of Health, I talk to hospital administrators and leaders, and hospital CEOs talk to me about the strains on our current system, patients inappropriately dropped off at emergency departments because people are in crisis and don't know what to do, difficulties discharging patients because there's nowhere for them to go. So even the private hospitals are becoming safety net systems. The signs are all around us. Things as they are not working. I am so happy to be here today because I know the future is nevertheless bright. You all will bring new ideas and the impatience of your generation for change and for us to do better. I know you are with me, and that's why I love students, because my interactions with you all tell me that you get it. But let me say it a little louder for the people in the back. Something must change. And no, it's not easy. Look around at our society and what do you see? We have more information and resources at hand than ever before, and we have more distractions and detours that tempt us off the path. We have an abundance of scientific data and advances, and we have an abundance of disinformation and rejection of science. We have new life-saving medications and therapies, and we have serious unresolved barriers to affordable access for that care. We celebrate diversity and acceptance, and we struggle with entrenched structural racism and hostility. We have greater connection and awareness of other communities around the world, and we have ongoing blind spots that prevent us from seeing others' pain. And sometimes we see it and we still turn away. We have dedicated health professionals pushing the latest scientific advancements and health recommendations forward, and we have declining trust in science, government, and other societal institutions. But again, like I said, events like today give us all some hope. Hope for our society and hope for the nursing profession. You all are sitting here, so you have already proven you can do hard things. University of Minnesota graduates can figure out the hard things. Minnesotans can figure out the hard things, especially when we do it together. When I was a student, I hated team projects. I really did. But team projects are important because providing high-quality health care that addresses a patient's needs requires a team. Interdisciplinary care is foundational to quality care, especially when the person has complex health needs. And we talk more about and do more interdisciplinary training than ever before because of that. Similarly, creating the conditions that promote health is complex. It's an all-hands-on-deck group project. Public health cannot do it alone. We must do it together in partnership. And we in public health especially look to you in healthcare. Healthcare professionals on the front lines to be our partners in working to address the full array of factors that impact health. During the pandemic, public health forged new partnerships with healthcare and community-based organizations. There were a lot of difficult moments and choices, but we can be proud of the work we accomplished in the spotlight. Minnesota was among the top states in successfully striking the balance of protecting public health, limiting disease spread, and ensuring the stability of our communities and economy. After the pandemic, yes, there are some scars, but we have before us a new generation of bright, motivated, and well-trained healthcare professionals ready to join the ranks and help us accelerate the good work. I suspect that somewhere in the group of graduates here, we may have future nurse managers and heads of nursing and even hospital executives and CIOs, and I really hope a public health nurse, 1 or 2. Can I get 10? 20, anyway. Perhaps even a commissioner of health. I would not be surprised. Wherever your path takes you, we at the State Health Department will be happy to be your partners in health. Our work impacts people's lives for the good. And because of that, even on you all's most difficult days, when it gets hard, what will keep you going is the difference that you are making for people. As you choose your path, if I have any advice for you, it's this. Find the courage to listen to your inner voice. The toughest work for you might not be what you had to do to get this degree, or the next degree, or going into your new job. Your toughest work might be finding the courage to listen to your inner voice, to listen to that inner knowing. I'm not talking about listening to the you that's talking to you from up here, but the you that is talking to you from in here. And I say this because those of us who are inclined to STEM fields, science, technology, engineering, math, the clinical sciences, when we have to make a tough decision, we can do a lot of cognitive somersaults. We can write a million pros and cons lists, right? We could do that all day long, especially when there's uncertainty. I've done that repeatedly. But what has been most helpful to me was listening to my inner voice, finding the courage to do that. I think most of us first hear that voice as a warning. Ooh, that's a bad idea, don't do that. You know, that warning, you feel it in your body. And what I am telling you is to pay attention to that inner voice. Yes, when it shows up as a warning, but also when it shows up as affirmation. When you get that feeling, and literally it is a feeling, right? I don't know if y'all have had that feeling. Maybe you had it when you chose to enter nursing. But it's hard to describe, but it's like a tug, right? It's that feeling that says, no, this doesn't feel right. Or, oh, yes, this feels fantastic. It's something that when you push it away, it boomerangs back. It's an embodied knowing, a self-discernment. It is your soul speaking to you about your purpose. At first, that inner voice is soft, often drowned out by everyone around us. But over time, it can become louder. You might need a few experiences to gain clarity, which will turn up the volume. You might need a few experiences to get real about what matters to you, which will turn up the volume. You might even need to fail at something, which will turn up the volume. You might even need the encouragement from someone who loves you. For me, that was Teddy Potter, who's up here on this stage, was one of those people which turned up the volume. I am only here in this incredible role as Commissioner of Health because I let go of what others said I should do. I had to find the courage to trust my inner voice, to let it guide me, to be my navigation, to be my GPS. Commissioner of Health was not on my radar. It was not. And yet, here I am. And yes, the classes and the training were important, and the mentorship and all of the things, but none more important than finding the courage to trust myself. We are doing big things in Minnesota, and I can't tell you how fantastic it is to feel the energy of possibility. And as you go forward, trust yourself. When you're at the bedside and something just ain't right, follow that up. If you're on a path in a job and it just don't feel right, you can pivot. Your future is bright. Oh, y'all can do so many things. I can't wait. I can't wait. I'm excited for you. I'm excited for our future. I'm excited for the future of healthcare, for the future of public health, for the future of informatics, for the future of health coaching. Congratulations, you all. Thank you.